Today, I want to talk to you about something that, unfortunately, we are all at risk for: cancer. Cancer is something that we need to identify, hopefully, detect it early, because once it's far advanced, there's little that we can still, at this moment, do. So, the cancers that I want to discuss, I just want to first discuss the signs and symptoms that you need to keep in mind. Number one, if you bleed from any orifice, coughing blood, pooping blood, peeing blood, and it's just not occasionally, it's like it's getting worse day by day, we need to look into evaluating to make sure that you don't have a cancer. If you start noticing lumps or bumps in the anterior part of your body, neck area, breast, even men, axillary areas, belly, inguinal area, in men, testicle, we need to look into it. If you start noticing that the white part of the eye turns yellow and it's painless most of the time, but sometimes it's painful, we need to look into it, making sure you don't have a type of cancer. If you start losing weight, but you lose it very rapidly, case in point, I have a patient that I saw recently that in 3 months he lost almost 40 pounds. We need to look into that. If you have a skin lesion that looks weird, it looks abnormal, a mole or an ulcer in your skin, and it's not healing, it's looking worse day by day, week by week, we need to look into it. And of course, if you have pain that is intractable means that it's not going away, it's getting worse day by day. Again, the anterior part of your body most of the time. Your head, headaches, chest pain, belly pain, back pain. And most of the time, these pains are not responding to medications anymore for pain. We need to look into it. Now, the five cancers, and I'll describe the main symptoms for each one of them. And all of them can have all of them, but the main symptoms. Pancreatic cancer, number one. That is very common for the patient to present with epigastric pain, abdominal pain that is getting worse day by day. They can also, because of the communication between the pancreas and the intestine through the common bile duct, we can have jaundice, yellowish of the eye. At the same time, because of that same problem, we can have itching, weight loss, and so on and so forth. The other cancer that is very common is gastrointestinal, colon cancer. And again, you're going to have patients complaining of bleeding, rectal bleeding. They're going to have patients experiencing abdominal discomfort, pain, lower abdominal pain, weight loss, same symptoms, similar symptoms, I should say. We need to look into it. The other cancer that is very common is breast cancer in women and in men too. So that's going to be lumps or bumps in your breast, right? Pain, maybe, but a lump, hard, like a rock, getting bigger. We need to look into it. And the next one is the cancer that we need to always remember for men is prostate cancer. Prostate cancer in men is more, besides pain, is more the inability to pee. There's an obstruction. They're not able to pee, but it hurts. Rarely blood, but more than anything, they're not able to pee. Weight loss, lumps or bumps sometimes. So we need to look into it. So that's my talk for today. Just keep in mind that the signs and symptoms that you feel, know your body, because most people, unfortunately, they think that they're getting older. And that's why they feel those things. And I want to discuss one more cancer, lung cancer. And lung cancer is going to be more bleeding, hemoptysis, coughing blood, painlessly, weight loss, sometimes pain, lumps or bumps sometimes, but more than anything, bleeding. We need to look into it. So keep those in mind. See your doctor, see your primary provider, your primary doctor. if you feel any other symptoms, because all those symptoms merit investigation. And remember, as I always say, the greatest wealth is health. Take care of